5% of people in the U.S. suffer from a heart arrhythmia or irregular heartbeat. Some arrhythmias can be harmless while others are life-threatening. Here now to discuss is Dr. Mir Friedman, a cardiac electrophysiologist with Hartford Healthcare's Heart and Vascular Institute. Doctor, welcome.
Thank you for having me.
Great to have you. This is so important. Explain what a heart arrhythmia is and what causes it.
So the heart is a pump that supplies blood to the whole body, and it is driven by an electrical system. And whenever that electrical system and wires create any problem, that's known as an arrhythmia. It can be broadly categorized into two, either going too fast or too slow. There are a lot of reasons why arrhythmias may occur. Some of the main ones are a heart attack, medication relation, heart failure, and age as well.
And that's what I was just going to ask you. What kind of a factor does age play in arrhythmia?
So as we all know, our bodies change with age, and so does the heart. And some arrhythmias become more prevalent, more likely to occur as we age. However, important to realize that not all do, and young patients, including teenagers and young adults, can have arrhythmias as well.
All right, doctor, what types of symptoms or warning signs would a person have if they are having an irregular heart rhythm?
So the symptoms and warning signs could be variable. The most important thing I tell my patients is if there's something new for you, you should seek medical attention. But broadly speaking, we're talking about new onset of shortness of breath, chest pain, palpitations, dizzy, either passing out or nearly passing out. If patients notice that their legs are swollen or are gaining too much weight, those are all things that should be looked at and assessed.
Okay, and now let's talk treatment. Can these types of issues be resolved? And tell us about the advancements with not just diagnosis, but treating arrhythmias.
Absolutely, and that's when it gets complicated. I think the most important thing to do is to seek medical attention with the experts. We try to tailor treatments to specific patients within their comorbidities and their specific arrhythmia. We sometimes use medications to treat these. Sometimes we observe. On occasion, we recommend something called an ablation. It is a procedure where we enter the heart with catheters and we try to find the spot that's causing the problem and cauterize it. And this is an exciting field, and it's been changing over the last few decades. And the next few years, I predict something tremendous advancement with new technology, with safer approaches coming along.
I love your passion just talking about it. What kind of recovery time would a patient have if they had an ablation?
So believe it or not, a lot of patients go home the same day after an invasive procedure or the day after. So despite being quite important and quite invasive, we have minimally invasive approaches, and patients do quite well.
Great to hear. Dr. Mir Friedman with Hartford Healthcare's Heart and Vascular Institute. Thank you for joining us, and continue your passion. Great work. Thank you, doctor.
Thank you for having me.